In aftercare, as I see aftercare, that is, you've left the mothership, you're in your home setting, and it's okay. How are you getting on? How's life? How are you adjusting? One thing I remember from aftercare, I've come out of clouds, I'm raw, and it's as if suddenly the lights were brighter, my sense of smell was stronger, my taste was stronger, all my senses are heightened. And I remember the time when I was invited to my first party. Am I going to go? Aren't I going to go? What's it going to be like? How can I talk to people without the Dutch courage of alcohol or a line of cocaine? And I remember coming to my aftercare group and saying, well, I've been invited to my first party. I don't know what to do. And the essence of aftercare, and the essence of group, and the essence of the formula of the whole recovery movement, often described as the therapeutic power of one addict sharing their experience with another, is without parallel. And sure enough, in that aftercare, the magic happened. There was a guy who was 2 weeks ahead of me. He'd been to his first party. What was it like? What did he do? What didn't he do? And we discussed it. Who do I go with? Do I take a sober companion? But the great revelation was, yes, I could go and I could leave. And the reality was, the entire party would not grind to a halt and go into slow motion as David Charkham left the room. They probably wouldn't even notice. So that's a little experience that I add and use, and if necessary, role play all those interactions with an aftercare group. Another one that is relevant for aftercare, relevant for my workshop, is the question, oh, hello, you're looking well, where have you been? For some people, it's quite simple. I've been in rehab. For some people, they don't want to say that. For some people may say, oh, I've been studying in Edinburgh. Or I've been unwell, or I'm not drinking because I'm on antibiotics. There's no stock answer. I get people to role play it, rehearse it within the safety of the group, and let them discover what they're comfortable with. Because kind of unknown to the great public, there's a lot of treatment language. It's spoken, it's a treatment language. After a couple of weeks, it's like a shorthand amongst recovery. The work that I will do at Castle Craig is interesting for me, unlike the groups that I may be doing in other parts of England and around the world. They're probably the largest groups that I'll take. It may be 25, 26 people each group. But I will say, look, you've turned up on time. The fact that you're in the room gives me a message which says, David, I want to improve the quality of my life. And I will say, you know what, that'll do, let's start.